Hello everyone, and welcome to a new video on cardiac output and stroke volume. So in this video we're going to be looking primarily at this idea of cardiodynamics, where we look at terms like in diastolic volume, in systolic volume, stroke volume, and cardiac output. And using that we will learn to calculate a stroke volume and a cardiac output as well. And we'll look at the meanings of these particular things. So let's start off by looking at what cardiodynamics is. So this is all about forces. These are the forces and movement of fluids during cardiac contractions during systole, right? And in here there are terms like the EDV, end diastolic volume, the end systolic volume, stroke volume, and cardiac output. These will be the terms I will focus on. You might also see words like ejection fraction. So let's start off and look at what these terms end diastolic volume, stroke volume, and end systolic volume all mean. Let's look at those and see what those mean. So first off, what I want to do is draw a simple drawing of a human heart. This is not a real drawing, we know that. And we're going to focus purely here on the left ventricle. And in the left ventricle, let's understand that cardiac cycle has two major phases. Systole, which is a squeezing, where blood leaves a chamber, and diastole, a relaxation where blood fills the chamber. So let's imagine this left ventricle is undergoing ventricular diastole, and it is filled with blood. It is now at the fullest point that it can be, and that volume of blood is called the end diastolic volume. That's the amount of blood that the ventricle is filled with at the end of ventricular diastole. And then at the end of systole, after systole occurs, some of this blood is pumped out. And as that blood is pumped out, not all of it leaves, and the remaining blood that's left, the amount of blood in the ventricle at the end of ventricular systole is called the end systolic volume, or the ESV. Now, it should not surprise us that when this blood was ejected, that blood was pumped out, and the blood pumped out is called the stroke volume. Now, it shouldn't surprise us that stroke volume is the difference between EDV and ESV. To say that the equation for stroke volume is the EDV minus the ESV. Right? And if we were to take this and do a graph of that, what you would notice is over time, in the volume of the left ventricle, you would begin to see that there was two values, 130 and 50 milliliters. And these milliliters here, if blood, for example, starts to fill up the heart here, and then blood would leave, right? We would have blood coming in and blood going. And what you would have is this ventricular filling here, passive filling, etc., active filling, and then we have our EDV. At the end of filling, the 130 mils would be a normal EDV. Then our stroke volume is produced when a cardiac ejection occurs and the blood is left over, is called the end systolic volume, and that's about 50 milliliters in a normal, happy, healthy human. I apologize for the phone call right in the middle of this, but I'm not going to stop. So this is the different volumes and what we would see going on there. So to understand this equation, we take that and put it on that graph, and we can witness what's going on there. So very important indeed. What I want to do to really drive this home is do something a little bit different. I'm going to take a normal EDV, ESV, so let's take EDV and an ESV for a patient. Let's do 130 and let's do 50 here. But then let's do on another person, let's do where this EDV now is gone up at 140, and we'll keep the ESV at 50. And let's do a third person now where our EDV is kept normal at 130, but the ESV is now 60. So what you'll see is I've got normal here, but I've increased one value in the other two. Now remember, stroke volume, the equation that we're using here, stroke volume is equal to the EDV minus the ESV, the end systolic volume. So here we would have stroke volume equals 130 minus 50. So if I did that math, what I would find is that the stroke volume for this patient would be 80 milliliters. 80 mils of fluid was pumped out in that heartbeat. And so here we would notice that this is our normal standard value we're going to use. Now, if we took this stroke volume here for this patient being 140 minus 50, let's take 140, subtract that from the normal ESV of 50, and you're going to notice the stroke volume now is equal to 90. What you are noticing here is an increase in EDV is equaling an increase in stroke volume. And actually, the converse would be true. If you decrease the EDV, this would also decrease the stroke volume. This is a very important relationship to have in your mind. And mathematically, we've shown that at least partially, and the converse would be true due to that's the way mathematics works. So then let's look at stroke volume being 130 minus 60. So if I took my 130 minus 60, now what I've done is I've seen the stroke volume is 70 milliliters, and this is showing me another very important thing here. 70 is much lower here than our normal 80. It's 10 lower, right? And what we're going to look at here is if I increase the ESV, then I will decrease the stroke volume. And if I decrease the ESV, I increase the stroke volume. These are also an incredibly important relationship to understand. And we wanted to do that mathematically. So now we know how to calculate stroke volume, and we did 3 basic examples of that. Memorizing this equation here is a required thing to do. So now let's take a look at cardiac output and what cardiac output is. So if we go back to our original drawing where we took a heart and we had a left ventricle where we had blood in that called the EDV, and then we pump that blood out and we produce an ESV, and that blood produced a stroke volume. What we're going to look at is how many stroke volumes per minute. To say that cardiac output is equivalent to the heart rate times my stroke volume. How many stroke volumes do I have per minute? Because of how many times the heart beats per minute. This would be as the blood being pumped out of the left ventricle in a minute's time. So what we have is a volume multiplied by how fast the heart beats. Now, a normal heart rate ranges somewhere between 70 to 100 beats per minute is your typical heart rate. And we know that a typical stroke volume is sitting here at 80 milliliters. So what we want to do with this is to understand that cardiac output is heart rate times stroke volume. This is an equation we must memorize as well for quite a long time. Let's take our cardiac output and find it for a patient that we have a heart rate who is 70 and a stroke volume was determined to be 80. So now we're looking at 70 times 80, right? And 70 times 80 would be found to be a cardiac output equal 5,600 milliliters per minute. Or to say 5.6 liters per minute if you're doing your conversions. So cardiac output really isn't that complicated. But let's look at this and let's keep a stroke volume and look at a couple things here and do what we did here. So we said that 70, 100, and let's do 110 as my heart rate. And what we're doing is increasing the heart rate, having these two as normal heart rates, and use a stroke volume of 80 for both of these abnormal ones, a little higher ones, and see what these things do. So cardiac output here would be 70 times 80, and we do know that 70 times 80 being 5,600 milliliters per minute. But now let's do 100 times 80. That would be the cardiac output here. So being 100 times 80, you're dealing now with an 8,000 milliliters per minute. And if I did 110 times 80 for my cardiac output, 110 times 80 would be 8,800 milliliters per minute. So you can see that heart rate will influence this dramatically. But let's do a great example here of a patient who is bleeding. If you have a lower blood volume, a reduce in blood volume would result in a decrease in venous return, and we know that venous return is a major factor that influences the stroke volume. So if stroke volume is normally 80 here, let's drop it to 60 and see what would happen here. Now, let's say that I need to know I want 5,600 milliliters a minute still coming to my heart. I have a stroke volume that is 60 mils, but I need to know what the heart rate would be. Knowing that normal heart rate ranges between 70 to 100 beats per minute, let's find out. How we would do this is divide by 60 on both sides to cancel it out. So 5,600 divided by 60 would give me 93.33 repeating. So my heart rate would have to be about 93 or about closer to 94 beats per minute to keep a normal cardiac output when my volume is dropped down considerably. If I've lost from 80 mils of blood in the ventricle down to 60. So you're going to see that heart rate would always go up when stroke volume goes down. That's a very important thing to learn. This is what happens in the patients of shock. So what we've been able to do is figure out cardiac output, stroke volume, and a variety of other factors here and applied it to a more clinical scenario here. And I really hope these calculations and explanation of what is going on here is helpful to you. And as we come back to what we discussed we were doing. So I look forward to making more videos on such topics, especially love teaching cardiac stuff. And if you like this video, don't forget to watch my video on regulation of stroke volume. And I'll put a link in that as well on my YouTube channel. So thank you guys so much for watching. Please don't forget to comment, like, subscribe. Let me know what you want to see in future videos. But thank you so much for watching. Thank you.